Okay, so you've likely seen the headlines. Former President Biden diagnosed with an aggressive form of prostate cancer.
And we now know it's spread to the bone.
Exactly. So for those of you tuning in, you're probably here to understand, what this news really means.
And why it should matter.
Right. So let's try and cut through some of the noise and get right to the core of this situation.
Well, this situation with President Biden, it really shines a bright light on a pretty complex area of men's health, doesn't it?
It really is.
We're going to try and unpack the nuances around prostate cancer screening.
Especially for different age groups, yeah.
Yeah, exactly. And walk through the treatment options, too. Because there's a lot of, conflicting information out there sometimes. So our aim is really just to give you a clearer picture, a better understanding of what's important here.
Absolutely. And you're probably asking yourself some key questions right now. Things like, could this have been caught earlier?
Yeah, was it preventable?
What does it mean for other men? What are the essential things we all need to understand about prostate cancer generally?
Okay, let's get into it.
That's it.
Maybe we should start with the screening part, because President Biden's diagnosis really highlights how tricky that can be.
It's not straightforward.
No, not at all. Especially for men over 70. It's a real balancing act.
Definitely. I saw that quote from Dr. Michael Morris. He put it really well. Excellent care means not under-testing. It also means not over-testing.
That nails it. That really sums up the challenge here.
And you'd think with someone like a former president, they'd have, the best care possible.
That's right. And, while routine PSA screening isn't usually recommended for men over 70 because prostate cancer often grows so slowly,
Right.
Dr. Lee Richstone made an interesting point. He said he'd be pretty surprised if President Biden's PSA levels weren't being monitored regularly.
Given his profile, yeah.
Yeah, given his health profile.
Which makes it interesting then that his public physicals during his presidency.
The ones from 2021 to 2025.
Yeah, those. They didn't actually include any specific PSA screening data.
That does raise questions.
It does.
And it sort of underlines another really critical point from Dr. Richstone, which is that even aggressive forms of prostate cancer, sometimes they show up with normal PSA levels.
So the test isn't everything.
No, definitely not. Relying just on that single test isn't foolproof. In those cases, other things like a digital rectal exam or maybe an MRI become really important.
Other detection methods.
Yeah, exactly. So it's not just about that PSA number.
Okay, so let's shift focus a bit to the diagnosis itself. The timeline seems, relatively quick. We understand he had some urinary symptoms.
That's right, which led to finding a nodule.
And then, unfortunately, the confirmation that the cancer had spread to the bone. That sounds significant.
Well, yeah. When prostate cancer metastasizes, when it spreads beyond the prostate gland itself.
To other parts of the body, like bone.
Exactly.
Yeah.
It generally does mean a more serious prognosis. But, and this is important,
Okay.
it's important to stress that there are still treatment options available. And how the disease progresses can really vary a lot depending on how someone responds to the therapy.
So it's not totally predictable.
No, not at all.
It's a snark reminder, though, isn't it? How common prostate cancer actually is.
Oh, absolutely. Second most common cancer in American men, right after skin cancer.
And the risk goes up significantly with age.
It does. And it's a sobering fact, too, that Black men face a higher risk, both of getting it and, sadly, of dying from it.
Yeah, I saw that statistic, 3.5 million men in the U.S. living with prostate cancer back in 2022. That really puts the scale of it.
It puts it into perspective, yeah.
What seems particularly relevant here with President Biden's diagnosis is that most prostate cancers are actually quite slow growing.
That's right. And in many of those cases, doctors might just recommend what they call active surveillance.
Which is basically just watching it closely.
Yeah, monitoring it carefully without immediate treatment, especially if it looks like it's low risk and not, progressing quickly.
But it sounds like President Biden's situation is different from that.
It does seem that way.
We've heard about this Gleason score of 9 and a grade group of 5. For those of us listening, what do those numbers actually mean?
Okay, so according to the Cleveland Clinic, those scores basically tell you how abnormal the cancer cells look compared to healthy prostate cells.
So higher is worse?
Generally, yes. A Gleason score of 9 and a grade group 5, that signifies a high-grade aggressive cancer, which, fits with the news that it has already spread.
So those scores are really key indicator.
For how the cancer might behave and, crucially, for deciding on treatment.
And when we look at survival rates,
Yeah.
there seems to be a pretty big difference depending on whether it's spread or not.
There is.
The overall 5-year survival rate for all prostate cancer diagnoses is, well, it's quite high, around 98%.
Which is good news, generally.
But that number drops quite a bit, down to nearly 38% when the cancer has metastasized.
Yeah, that's a really crucial distinction. It's important to understand that difference. However, Dr. Etish Chowdhury pointed out something important here. While those overall statistics give us a general picture,
The 38%.
right, many patients with metastatic prostate cancer are actually living longer now than those averages might suggest.
Because of better treatments.
Exactly.
Yeah.
Largely due to significant advancements in treatment options.
Hmm.
So, yeah, 38% is a stark number, but it doesn't necessarily define any one person's outcome.
Right, right. Which brings us neatly to the treatment side of things.
Mm-hmm.
We understand that President Biden's cancer appears to be hormone sensitive.
Yeah.
What does that actually mean in practical terms for treatment?
Okay, so that's actually a really significant piece of information. And often it's a positive sign
How so?
because hormone-sensitive prostate cancer tends to respond well to therapies that target hormones, specifically testosterone.
Which fuels the cancer growth.
It can, yes. Testosterone can fuel the growth of prostate cancer cells.
Hmm.
And Dr. Morris described these hormone-based treatments as being especially potent and durable in these cases.
So how do they work then, these hormone treatments?
Well, there are a couple of main approaches. One common way is using medications to lower the body's overall testosterone levels,
Okay.
and the other involves newer types of drugs that specifically target the pathways within the cancer cells that let them use testosterone to grow.
Ah, more targeted.
Exactly. And Dr. Morris mentioned that doctors often use a combination of these strategies for a more comprehensive effect.
Makes sense. Are there other treatments that might be on the table beyond hormone therapy?
Yeah, potentially. It really depends on the extent of the spread and, of course, President Biden's overall health.
Sure.
But other treatments like, say, radiation therapy or even chemotherapy could also be options. The specific plan, though, that would be decided by his medical team after a really thorough look at his individual situation.
This whole situation, it really pulls us back to that ongoing discussion, that sort of confusion sometimes around PSA screening.
Oh, absolutely.
It really feels like there's no single right answer, does it? Especially across different ages and health profiles.
No, there isn't. And the medical community has been, well, wrestling with this for years, how best to approach prostate cancer screening.
You can see that in the trends, right? Diagnoses went down after those recommendation changes around 2007.
They did. And then they started to increase again after 2014.
Yeah.
It just reflects that ongoing effort to weigh the benefits against the potential harms of doing widespread screening.
So what are those main benefits and harms? The ones the U.S. Preventive Services Task Force talks about for men age 55 to 69. What's the core of that balancing act they mention?
Okay, so the main potential benefit is pretty clear. Catching aggressive cancers early.
The ones that could become life-threatening if you don't treat them.
Exactly. But the flip side is that screening can also pick up really slow-growing cancers. Cancers that might never actually cause any problems during a man's lifetime.
Right, the overdiagnosis issue.
Precisely. And that can lead to unnecessary biopsies, unnecessary treatments, which all carry their own risks and side effects.
Anxiety, quality of life impacts.
All of that. So, as Dr. Chowdhury put it, it's about finding that sort of sweet spot where we catch the dangerous cancers early, but we avoid the problems of overdiagnosis and overtreatment.
But it sounds like there are pretty strong opinions on both sides here.
Oh, definitely.
We heard from Dr. Edmund Fulfak, and he raised a really interesting point about the risk of missing those aggressive cancers if we just treat everyone as like one big group.
And that's a key part of the counter-argument to the task force recommendations, you see.
Right.
The worry is that a broad guideline might mean some aggressive cancers get missed in guys who really could have benefited from catching it earlier.
And Dr. Richstone seemed to go even further.
He did. He suggested the current recommendations are based on what he called antiquated practices, especially now, given how much better our diagnostic tools have become.
Like the improvements in MRI technology you mentioned.
Exactly that. Dr. Richstone highlighted how now, if a man has an elevated PSA, it often leads to an MRI scan of the prostate first. And that lets doctors see suspicious areas much more clearly, and then they can do targeted biopsies right on those spots.
So it's more precise.
Much more precise. The result is you're more likely to find the significant cancers that actually need treatment and less likely to find those insignificant ones that don't. It's a more refined approach than just relying on the PSA number alone.
Okay, so lastly, let's touch on when men should actually go see a doctor about this.
Right.
Because urinary symptoms can be a sign, but they can also just be, a normal part of getting older for some guys.
True.
So what's the key guidance? What should really prompt that doctor's visit?
Well, Dr. Morris's advice seems pretty clear here. While routine screening is one thing to discuss,
Yeah.
any man who experiences new or worsening urinary problems or notices any sudden changes, like seeing blood in their urine or semen, they should definitely consult a doctor.
Don't wait for a screening test.
Absolutely not. Those kinds of symptoms need checking out by a primary care doctor or urologist, regardless of any routine screening schedule. It's really about, paying attention to your body.
Noticing changes that seem unusual.
Exactly.
Okay. So to sort of wrap this up, this deep dive into former President Biden's diagnosis, it really does underscore just how complex the whole landscape of prostate cancer is.
It really does. Screening, treatment, it's complicated.
We've learned that prognosis can be very different depending on the cancer's nature and whether it's spread.
But also, thankfully, that there have been huge advancements in how we treat this disease.
Which is hopeful.
Definitely. And ultimately, this whole situation just highlights how vital it is to have those informed, individualized conversations with your doctor.
About your own risks, about the pros and cons of screening for you.
Exactly. Staying informed is just key to making the best decisions for yourself.
So here's a final thought for you, our listener, to consider. Given everything we've talked about, this evolving understanding of prostate cancer, the ongoing debates about screening, what are the most important questions you should be asking your doctor? To make sure you're making truly informed decisions about your own health journey, no matter your age or public profile. Think about finding that balance, that personal balance between being proactive about your health and avoiding interventions you might not need based on everything we've explored today.